Hello and welcome. I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, science serves, publications, and social media. I would like to welcome everyone to today's partnership webinar, which is titled Climate Change and Toxic Hazards After the Storm. Our moderator today is Dr. Wendy Heiger-Bernays, Research Translation Core Leader of the Boston University Superfund Research Program. We will leave time following the presentations for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for speakers to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 1 hour and it's being recorded for our call-in webinar archive. With that, I'll turn things over to you, Wendy.
Thank you very much, Maria. So this webinar is hosted by the Boston University Superfund Research Program in partnership with the Collaborative on Health and the Environment, and specifically with the work of Maria Valenti. The National Institute of Environmental Health Science-funded Superfund Research Program is a multidisciplinary program with centers around the country, each conducting and communicating research with the goal of breaking the link between environmental exposures and disease. This research program is truly unique in that it has always emphasized solution-oriented, multidisciplinary approaches, research translation, and community engagement. This is the third webinar in our three-part series in which we've been focusing on climate change, toxic hazards, and how to protect the public's health before, during, and after a storm or flood. Our objective is to raise the issue of release of toxicants during storm events, resulting in exposure from hazardous waste sites, including Superfund sites, state sites, as well as from unregulated toxics used in industries and in our homes, and to provide information and strategies that communities, researchers, clinicians, and regulators can use to prevent toxic exposures. To date, we have focused on coastal storms, but as you know, the Midwestern U.S. has been significantly impacted by flooding, and the U.S. EPA reports that floodwaters have reached 8 Superfund sites in Iowa, Missouri, Nebraska, as shown on this map. Floodwaters prevent access for testing the waters and soils, and conditions may stay the same or even get worse before they improve as predicted by the National Oceanic and Atmospheric Administration in its 2019 Spring Outlook recently released. So the potential for toxic chemicals and radioactivity release from hazardous waste sites is real. In reality, will only increase, and we need to provide communities with tools to prevent exposures to these wastes. On our previous webinar, our speakers discussed preparation and response during storms by local and state entities for securing wastes and the necessity for appreciating a community's understanding of how waste moves and how residents can obtain information about wastes and health impacts and realities of on-the-ground communications during the event. Today, our speakers will focus on the cleanup process after a major storm or flooding event and ways to protect people during that process. Identifying the roles of individuals, agencies, businesses, and governments with a focus on practical actions to protect health and safety in the aftermath of storms. To do this, we're recognizing the incredible work and expertise of the NIEHS-funded worker training program, also established under the Superfund law. Our objective with these 3 webinars is to provide a good roadmap from planning for the disaster to cleanup after, with a focus on toxic substances and prevention of human exposure and disease. We will be compiling all of these resources into a single packet, which we will make publicly available. So I'll introduce each speaker, but their complete biographies are located on the CHE Call website if you want to know more about them. As Maria mentioned, we will send you a very short evaluation survey after the call, which will be very helpful in understanding future calls for your interests. So we hear first from Dr. Tom Estabrook, who is Project Director of the New England Consortium, an NIEHS-funded worker health and safety training program based at the University of Massachusetts Lowell. So I turn it over to you, Tom.
Thank you, Wendy. Thank you very much.
Thank you.
Okay, so my name is Tom Estabrook. I am Project Director of the New England Consortium, the Civil Service Employees Association, which is a worker health and safety training organization based at University of Massachusetts Lowell. We have 5 partners, worker advocacy organization partners for Coalitions for Occupational Safety and Health in New England, and the Civil Service Employees Association, the Health and Safety Department of the Civil Service Employees Association, which is an AFSCME local, American Federation of State, County, and Municipal Employees in New York State. So we are funded and have been funded since our beginning in 1987 by National Institute of Environmental Health Sciences worker training program, which began out of the Superfund Amendment and Reauthorization Act of 1986, which gave responsibility to NIEHS to start training grants program. So this program started in 1987, and it has funded hazardous waste worker training organizations across the country. So we started then too, so we've been around for 32 years. There are, at the moment, 22 awardee organizations that are funded by this program. They do hazardous waste worker training, they do hazmat disaster preparedness, they do health and safety training for nuclear workers, infectious disease preparedness, and environmental careers training. They've responded over the years to a number of disasters, sending trainers to different parts of the country, and including as well as Puerto Rico, to help in the cleanup, to help keep workers safe in the cleanup, which is what they've done. The types of training that they do is, there are a number of different types of courses, customized and standard courses, from the 40-hour hazardous waste operations course, 24-hour emergency responder, OSHA 10-hour construction safety, and shorter courses in muck and gut, so cleanup after storms, mold awareness, confined space entry, and workers' rights. The focus, so the types of workers that are trained through after storms, this is kind of the universe of people who are trained here. You'll see on the screen in post-storm cleanup. We have emergency management types, public works, people from local, municipal public works, state public works, public safety folks involved in cleanup. Then there are private contractors. This is a very large group of private companies that go in to help clean up. Many of those use day laborers, and as well the assistance from volunteers from neighborhoods, community volunteers, and then there are nonprofit organizations that do this as well. Nonprofit volunteer organizations. There is a network called the National Volunteer Organizations Active in Disaster, or VOAD. It was founded in 1969 after Hurricane Camille, and it has over 100 state and local member organizations. So what these organizations, what is done to protect workers and keep them safe in cleanup is training is necessary to deal with a lot of different types of hazards. There are procedures in place. There's planning that needs to happen for each of these organizations. Some organizations are actually better trained and better prepared than others. I would have to say those that are around consistently, like Public Works. Oh, I also want to include in there the building trades. So the building trades unions are also involved in post-storm cleanup. So some are more prepared than others. Some have ongoing training and are ready to go at the drop of a hat, and others have to be trained up quickly after a storm hits. So the types of controls that are done, this is the standard model here for protecting workers from a variety of hazards. And you'll notice in this hierarchy of controls, it starts high. This is sort of describes how it is in an industrial workplace. What happens in a post-storm cleanup situation is mainly those lower two elements, the administrative controls, which are the work practices, and the personal protective equipment. And the other things above that are things that are typically carried out in an industrial workplace. And so they may not be applied easily in a post-storm cleanup. These are two different sets of workers, cleanup personnel. The folks on the left are personnel that were trained at worker centers that was post-Sandy, so Hurricane Sandy in the New York, New Jersey area. And they are, a good number of them are, so these are trainers who have been trained to train day laborers out of worker centers in the greater New York, New Jersey area. The folks on the right are volunteers that were pulled together by volunteer organizations. There are a variety of these volunteer organizations. The folks may come from a wide distance, or they may come from just regionally. And so they are often poorly trained, poorly supervised, that the supervisors often just don't even have the skills in recognizing hazards. It's a large group of people, the volunteers, in those that responded to Hurricane Sandy were in the thousands, literally in the thousands, tens of thousands, to be honest, of the volunteers that came from local neighborhoods, and then it came from further distances. So for each of the types of workers that show up to have to do cleanup, these are basic prescriptions. And so this is from a fact sheet that's from our partner in New York State that also responded to Hurricane Sandy. Basic elements of things that cleanup workers need to follow: stay out of flood water, keep your body covered, use respirators, skin protection, sturdy boots, wash your clothes after you've been in a contaminated setting, watch out for utilities, don't let kids participate, be careful in how you're using tools, power tools, hand tools, and don't do it without training, and don't do anything without proper personal protective equipment. These are some of the hazards. You'll notice it's like an extensive list, from unstable structures. You know, just look down this list. It's pretty remarkable how many things are there. And what we found, and what different studies have found, is there's generally a lack of recognition of hazards on the part of many employers, especially small contractors and the volunteer organizations. They just have not had the training, especially for supervisors, owners of small contracting firms. They wouldn't know how to deal with the variety of these hazards that you see on the screen here. After the Sandy cleanup, one of the things that came out in a study, an assessment from the University of New York, was that the day laborers were not getting equipment. They weren't getting training from the contractors, from employers. So they were being provided with very little to go in and clean up homes. And also that the volunteers were not adequately trained from a variety of organizations. They weren't adequately trained to deal with the hazards that you see here. And this is, I mean, if you look at this set of hazards, this would require, I think, at least a couple days worth of training to be adequately prepared to go into harmful settings. So it's not just the hazardous materials, it's all these other hazards as well. So we can't just think about the chemicals. It's like slips, trips, falls, it's heat stress, it's dusts, it's working with tools, it's the ergonomic hazards, the lifting and the straining, it's energized utilities, it's the electrical, the gas, and confined spaces, unstable structures, you name it. So I already touched on this. If you're going to enter a space like this, especially this would be the case after some very extreme events like a hurricane, you would have to be quite trained to enter into a space like this, or even to know that you shouldn't enter unstable structures like this. And so only professionally trained people should be really going into spaces like this. Into floodwaters, usually we'll find this in the early stages of a cleanup operation. And again, it's recommended that cleanup people don't even approach a situation like this because of the hazardous substances that are there, the debris that's there. You just don't know what's in the water. Could be sewage, could be chemicals. And you have to use, if you are going to go in, you have to be trained enough to know that you have to have the right personal protective equipment on. So waders and skin protection and all of that. So dusts are often faced, and so again, the types of things that people have often done, like after Superstorm Sandy, going into buildings and tearing out moldy wallboard, and over months long, and even like a year long after Superstorm Sandy, you have to have the right training to deal with things like harmful dusts, asbestos, lead, and all sorts of other things that could be there, including mold. And you have to have been fit tested for the right type of respirator. So it does require extensive bit of training, and most people that go into those situations really don't have the adequate training. Again, what do you do in a certain situation where you've got downed power lines and you've got underground gas lines? How do you approach? Well, the volunteers and the day laborers really shouldn't be the people going into a situation like this, but often you do see kind of like homeowners and volunteers from around the neighborhood just walking through a setting like this. They are unprepared, they shouldn't be there, but who's to stop them? And who's to tell them you really need to back off and leave this up to the professionals to deal with? Other thing that we often see pictures of people, especially if it's like an extreme storm that's come in and knocked down buildings, walking around in the debris like this. There are so many hazards present that they really shouldn't even be doing this unless they've been fully trained and know like how to deal with what's there. So we're talking about unstable walking surfaces, hazards that could be lurking under piles of debris, chemicals, animals. There could be gas lines as well. So they're dangerous situations. Another thing that people, unless they've been adequately trained, and even then they may not be adequately trained, is how to deal with the traumatic stress. And this may really hit home, especially I think with people who are just unprepared, like community volunteers, and even volunteers from volunteer organizations and day laborers. They may not know how to deal with the long work days and just the intense emotions that may arise from having to deal with all of the destruction that they're facing in the cleanup. So there are a lot of things that could be done to prepare people and to support them during a cleanup situation. A lot of hazardous materials out there, and so this is just not even getting to talk about the industrial facilities that might have been hit and damaged, but there's a lot within residential neighborhoods, PCBs, asbestos, fuel oil, batteries and stuff, paint, just floating around in floodwaters. And so it's recommended that you don't even do that unless you've been trained and you know how to use personal protective equipment. Again, I mentioned mold. This is a big issue, especially in longer term types of cleanup, like post-storm Hurricane Sandy, where the tearing out, the mucking out of old damaged material, and so the mucking and the gutting is going to take a while. You need to have the right types of personal protective equipment and know what to do. So there needs to be training for all work crews on this. We have trainers in our training organization who've responded, who've actually gone down to consult and advise. So these are two pictures here from the BP, the British Petroleum Gulf oil spill from 2010. And you'll notice there's a difference in what they're wearing here And the reason I showed this is when they first started off at cleaning up the oil on the beaches, they were dressing out fully in full Tyvek skin protection. And what they found was that they got overheated and they were just not adjusting to that heat because it was really intense heat. When this happened, it was May, June, July of 2010. And so they made adjustments and they saw, okay, well, maybe we only need to like use PPE up to our waists. And so that's what they did. They started just wearing the protective pants, which you see in the picture on the right. So what this shows is that there is important adjustment that comes from training organizations that are advising cleanup people based on the realities on the ground. So they had the folks there, I want to mention a little bit from this. There was really disorganized training process. Volunteers were showing up, day laborers were showing up to various points along the Gulf Coast, and they weren't getting the adequate training. There were some organizations that didn't know how to train, others that were safety professionals that also didn't know how to train. And they were told that they needed the 40-hour training, the 40-hour hazardous waste operations training. And they just weren't equipped to kind of like do this. Things took a while and they kind of sorted out and got better as the process went along. But in the early weeks, it was very, very confusing. I also want to mention, and Rick is going to talk about this in a few minutes, the day laborers are especially at risk. A recent study from 2017, late 2017 after Hurricane Harvey, showed that they are quite vulnerable to being preyed upon by contractors who won't pay. And there were all sorts of other violations as well. They were getting hurt. They didn't have the PPE, the personal protective equipment they needed. And worker centers were actually quite helpful to the day laborers, but they weren't getting the training that they really needed on their rights on the job. So the lesson that came out of that, there needs to be much more done in advance to train them and to prepare them. For the volunteers, again, I've already touched on this, but the volunteer organizations will continue to play a significant role in disaster response. And NIEHS has seen that it's really important for them, for the NIEHS worker training program, to build relationships with these organizations to help them build the capacity within the volunteer organizations using what's known as train the trainer models, and giving advanced training to supervisors, field supervisors for the volunteer organizations. And so this is something that the building trades unions don't have to deal with because they actually are previously well-trained to respond to disasters. But the volunteer organizations are quite vulnerable, and there's a lot of room for growth there in preparation. So I want to move to conclusion. Much more attention needs to be paid, I think, to training people beforehand, people at worker centers, including and day laborers. The volunteers and the residents are especially at risk. And what they discovered in the Superstorm Sandy lesson is that the worker centers can play a huge role here in supporting the day laborers, in getting them trained beforehand, in getting them the right equipment that they need. And the day laborers actually can serve to promote safety among the contractors, the private contractors who often don't have the safety training, don't know about safety procedure, and homeowners as well, who they're helping out homeowners, and they have no clue as to kind of like, safety protections. So the day laborers can serve as a vehicle for spreading knowledge about safety. And so these are kind of some of the resources that we used, and I'll just conclude right here.
Thank you very much, Tom.
Yeah.
Let's hear now from Richard Rabin, who is an OSHA authorized trainer at MassCOSH, leading OSHA 10 and construction trainings in both Spanish and English for workers in a range of industries. Mr. Rabin directed the Occupational Lead Poisoning Registry at the Massachusetts Department of Labor for over 20 years. So I'll turn it over to you, Rick.
Okay, thank you. We're just adjusting this note one slide. There we go. Okay. Again, my name is Rick Rabin, and MassCOSH is the Massachusetts Coalition for Occupational Safety and Health. And I have, in addition to what you just heard about my background, I have given extensive trainings on this topic of disaster hazards. And I was also in Puerto Rico after Maria to train in Spanish. MassCOSH is an organization that provides advocacy and training to both day laborers, immigrants, any disadvantaged workers. And we're one of about 20 of these so-called COSH groups around the country. And there is a national coalition that coordinates some of our activities, the National Committee for Occupational Safety and Health. And very important in this training that we did at Hurricane Harvey in Texas was also another community group, a COSH group, a worker center is called Fe y Justicia Worker Center, Faith and Justice. They're based in Houston with deep roots and long time operation in the Houston area. And the other group that was very much very important in all this work was the Chemical Workers Union. They have a training institute in Cincinnati, and they were perhaps the most important group in this whole activity. They have a long background of providing training to people who work in disasters. They put together a curriculum, and they trained many of us so that we could train the trainers. Now I want to just show you a very brief, a 1-minute video that really gives you an overview of what we're talking about here.
When Hurricane Harvey hit, devastating Houston, we didn't have a minute to waste. Day laborers and recovery workers would soon be recruited for hazardous jobs with little or no training and absolutely no information about their workplace rights. National COSH teamed up with Fe Justicia Worker Center in Houston and the Chemical Workers Union to offer a bilingual train-the-trainer session. While in Houston, I saw firsthand the devastation to people's homes, their jobs, their lives. I met Leonardo, a recycling worker who lost his eye while cleaning a machine and lost his car during the flood. And Andy, a housekeeping worker and single mother whose home was flooded. And Chris Saldivar, a young organizer whose family was displaced after losing their home. I'm so proud that National COSH and our allies moved so quickly to deliver a crucial training event. We are building leadership and safe communities among workers most impacted by hazardous conditions. We will rebuild Houston and Miami and Puerto Rico and the U.S. Virgin Islands. However, we must do it safely, with dignity for immigrants, low-wage workers, and everyone in our communities.
So I think that gives you a good overview of what's involved here. In Houston, at the very end of August in 2017, Hurricane Harvey hit the Houston area. This is a weather map showing the extent of the rainfall, and in the Houston area, up to 40 inches of rain fell, and creating huge devastation. Let me give you, this is a photo of a bridge over a bayou. Bayou is kind of a meandering stream going from usually from a main river. This bayou was, if you will look over at the bridge, you might be able to see at the surface of the bridge some of the debris and weeds. This is the level that the river, the floodwaters came up over, and there are numerous bayous in Houston and the surrounding areas. And so this is where the water came up to, and the result was this kind of scene that you see here. We saw street after street after street, just like this, where residents had to pile all of their junk, all of their ruined belongings in their front yards. Now, why did they put them all in the front yard? Well, this sign kind of tells it all. It says, please do not remove these damaged items. FEMA needs to see it. FEMA is the Federal Emergency Management Administration. It's a federal agency that provides assistance, financial and otherwise, to people impacted by a storm. And so it turns out that in part, the amount of money recompense that homeowners would get was determined by the size of the pile in the front of their yard. So that is what this is about. The person that was mentioned, and as Tom mentioned in Fe Justicia, Chris, this is his home. And this is where the water got up to. And he was forced, he and his family, to at least temporarily move out until their house could be put back in shape. Now, as I mentioned, the chemical workers, the International Chemical Workers Union has a training site in Cincinnati, and they put together a manual. They trained many of us to go out and give these trainings. Here is just an example of the subjects that we covered. Now, you might, if you remember what Tom mentioned, a whole host of hazards are involved in cleaning up. And our trainings addressed all of those issues. But one thing that's very important when you train the trainer is you need to be aware of how people learn, how, in particular, how adults learn. And so just one example of that is what we call the random word exercise, which is a funny but rather stressful exercise where you pull out of the hat a word or a phrase. It could be hat, or it could be desk, or it could be a rabbit, any word at random. And then you have 2 minutes to talk about or illustrate that thing, that concept. And just keep talking and keep showing just off the top of your head. Everybody got a lot of laughs and probably got your blood pressure raised a little bit too. Again, more of what we did. We used a lot of the NIEHS booklets that in both English, Spanish, and other languages provided brief guidance on protecting yourself in mold remediation. So here's just an example. We drew on a variety of sources to provide the training. Limpieza después de inundaciones, post-flood cleanup from OSHA's page, NIEHS, which is the New York COSH group, had from previous storms developed this particular sheet, and there were numerous others. Here are some of the people that we trained who went on to train other people. I'm quite familiar with the man on the left. Alejandro, he is from the Fe Justicia, a worker center. He's fantastic with so much energy and connections with the community. We trained people, we trained 10 workers, and we trained 10 volunteers, mostly Spanish speaking on one end, English speaking on the other. Mostly we kept them separate, one in English, one in Spanish, so that participation could be, so that we could do participatory training much better. And then we would bring them together for different exercises, mostly when we were doing things like this, showing people how to use personal protective equipment, and stressing, as Tom did, the importance of proper protection, proper procedures. Here's an example. When people go out and do training, typically you'll see one of these 3 respirators, mostly the one on the left, the disposable. And let me give you some lessons or conclusions. Really, mostly Tom covered them, that people need to be trained, and there needs to be a source of this training, such as TNEC, the New England Consortium, or the OSHA training institutes, or the chemical workers. And
Rick,
yes.
Rick, it's Wendy. I'm going to interject here, and there's a great question that
Okay.
I want, that perhaps is the right time to ask.
All right.
Do you have an online training for homeowners, volunteers who want to work on their home or community facilities after these disasters?
We put together a manual with the chemical workers, and I think if you contact the Chemical Workers Union, and after, I can give you that information, the contact information, but they put together a manual.
Great, we'll compile that. I have another question.
Yes.
Where can people get prescribed protective equipment quickly, or should communities stockpile them?
Oh, that's a great question. That has come up numerous times. When Harvey struck and when others struck, there was actually a shortage of this kind of equipment. So this is an ongoing issue, and again, the Chemical Workers Union has access to this kind of thing, but there is no one source providing adequate personal protective equipment. But let me also stress that much of that equipment, you can't just put it on and say, I'm good to go. You need training on how to use it and how not to use it.
Yeah, that's correct. But I think the pushback is,
Yes.
absent anybody coming to help, how do communities prepare so that they can respond after the storm?
Right, right. There is no, there's not adequate funding and resources to help people nationally when a major disaster hits. Up till now, it's been just addressing issues as they come up. But I would say the best thing at the moment is contacting the Chemical Workers Union to see what can be worked out. Also, the National Institute for Environmental Health Sciences, their website, which provides these booklets on all sorts of hazards, are 2 of the best resources to go to at the moment.
So I'm going to push you even further.
Yes, ma'am.
So, you know, tomorrow or the next day when the waters recede in the Midwest, what's going to be the strategy there based on what you and others have learned from your experience?
Well, if experience is any guide, what will happen is that homeowners and day laborers will go out and do the cleaning up, the mucking and the gutting without proper protection, proper training. If we're lucky, within a few weeks or a couple of months, an organization such as the chemical workers or COSH with the right resources will step in and train people. But anticipating what'll happen right now, what'll happen is people will go in and put themselves at risk because they don't have the equipment and the training.
So again, I'm going to push you even further.
Ouch.
Yes, I'm sorry, Rick, but so there's nothing there. They haven't planned. There are few resources and people are left really to their own devices. Is there a sort of a priority list or absolutely here is what you never ever want to do, but here are some of the things that you might have to do and until you get help. So,
yes,
is there a priority list that you can give us?
Well, these booklets put out by the National Institute for Environmental Health Sciences are very good at the basics of what you should do and not do and what precautions you need to take. And it's put in very simple language. So that is what I would refer people to.
Okay.
Does that answer your question?
Yes, sort of.
Sort of, yeah.
We say we have to train. We know we have to train, but the reality is we have so many impacted communities and little access to trainers, and nobody's prepared.
That's right. That unfortunately is right.
Okay, so it's my house. I'm flooded. There's nobody around me to do anything. Again, I'm going to push you. Should I stay out of the basement? Should I sort of what's my plan? Do I contact my legislator? Where do I go? Like, we're here now.
Right.
Okay. All right.
My laugh, I guess, tells you what kind of an answer I have. You can go to your legislature. I mean, certainly long-term, medium-term, long-term, you definitely want to do that so you're prepared for the next time. But going to your legislature may get some money, in the next several weeks or months. But if you're talking about today, tomorrow, next week, that isn't going to help.
Okay.
Yeah.
One other question has come up. I know that this is mainly about emergency workers and volunteers, but do you have any program project that aims to build community resilience, especially in vulnerable populations such as young children or the elderly?
I'm not an expert. I'm not familiar with all of that. I don't know, Tom, do you have anything to say about that? Protecting the community as a whole. That's excellent point, and I'm probably not the person to.
Okay, so I'm going to bring Tom back.
Yes.
Because Tom actually had raised something earlier that we had not discussed, which was the potential for people to, in a bad situation anyway, for them to be taken advantage of by untrained and unscrupulous workers, perhaps, or companies to clean up.
Yeah, so the
contractors.
Yeah.
So I'm going to ask you about that, but we have two comments that I want to raise here. One is that there seem to be sources, the CDC, the EPA, et cetera, and somebody from EPA tells us there's a 107-page guidance document on how to return. So if you have time to read that,
wow.
then we'll make sure that's available, and they're hoping to turn that into videos soon. But I want to turn it over to you, Tom,
Yeah.
because based on the experience that you've had, you know, the reality is we have untrained people, we have people who are in a really bad situation.
Right.
You know, what's your sort of top of your head, what do people need to do? And then speak to this unscrupulous or whatever you had called it.
Yeah, so I think the experience of what went on after we look at specific storms. So what happened in the aftermath of Harvey and Hurricane Sandy in New York, New Jersey, was that the non-governmental organizations end up like picking up a lot of the slack, like the worker centers. The worker centers have access to a lot of the neighborhood, low-income, working class volunteers that may step in to help out. So they can reach out there and help to inform them. And then those, as I mentioned before, the day laborers can serve as a conduit to homeowners too, because homeowners are actually trying to find people to help them clean up their mess. And a lot are relying on day laborers. So the day laborers, if properly trained through worker centers, can really provide a great service that local governments aren't doing. So I think this is a question of like how government can actually work in concert with community organizations to protect people, to protect volunteers, to protect day laborers, make sure they're not getting ripped off by unscrupulous contractors that aren't paying them. From the study that came out of City University of New York, I think it was 2014 after Hurricane Sandy, they recommended that a lot of state, governmental resources go into supporting the worker centers, because the worker centers know what's happening on the ground, and they have access and real connections to people actually doing the cleanup.
Yep.
The day laborers and the volunteer organizations. But there should also be attention, I think, spent on cultivating relationships with the vast network of volunteer organizations, faith organizations, other relief organizations that send people. Okay.
So, yeah, so many of these places are small towns, no worker safety organization.
Yeah.
Who do I go to after the flood?
Yeah, it's a good question. I mean, it really depends on where you're at and how does one connect? I think it takes relationship building, and so if you're just like in a small town, let's say in Nebraska now, okay, you're like just the floodwaters are starting to recede and you've got a total mess left behind. What do you do? I don't know what you do. But if you're there, I would first approach kind of like, local government or Nebraska Emergency Management Agency. I think there need to be better connections, I think, between the work of NIEHS and the state emergency management agencies. That's a huge area where stronger relationships can be built, I think, to show, okay, who's got resources to do what? Because government can't do this by itself. You need community to really step in to protect local people doing cleanup.
Okay, and
let me just say also that community groups and the COSH groups and worker centers have the trust of people, particularly day laborers, immigrants who don't have papers. They're not going to want to deal with the government. They distrust the government. So these community groups are absolutely crucial to get the training and the proper reaction to disasters.
right. So I have one more question. What organizations run worker centers?
Well, some COSH groups run worker centers. In general, worker centers are run by workers. And they help, they go to the corners where workers gather for work. So every area, every city is a little bit different, but they're organized by the workers themselves.
Okay, so are there any other questions from anyone who's listening? What we will try to do is to compile the information that others have shared with us. I think what we're hearing is that there is an enormous need to both train and to educate community members and organizations about how to respond after the flood. And I'll look to Tom and Rick to see if they would agree with that statement.
Oh, yes, absolutely. And I just want to say that all is not bleak here in the sense that these disasters also present an opportunity for community groups, for worker centers to develop their skills in organizing and in health and safety, and to deepen their connections to potential allies, experts, public officials, unions, so that the next storm doesn't hit us unprepared.
Okay. Any other questions, comments? I think I will turn this over to Maria.
Okay, great. Thank you so much, Wendy. We are approaching the end of today's webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the recording. It will also contain a link to the survey that Wendy mentioned. Please take a few minutes to complete it so that we can tailor future webinars to your interests. CHE's next webinar from the CHE EDC Strategies Partnership will take place Wednesday, April 17th, and will feature the European Helix study. Details will be available on our website soon. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers for taking the time to present today and Wendy for her excellent moderation. Thank you so much for joining us and have a great day.